Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. This set of questions is all about orgasms and some of the problems that might happen with male anatomy. All right, first question. I'm 15, and when I reach orgasm, there's not that much sperm. Sometimes there's none. Help! Okay, so did you know that semen production, and semen is what the fluid is called that nurtures and surrounds the sperm. Did you know that semen production is actually a part of puberty? It usually happens after the growth spurt, so if you are in the middle of puberty and don't notice all that much semen production, totally normal. Totally fine. I wouldn't worry too much about it. If you finish puberty and you are still not seeing much semen production, you can talk with your doctor, but keep in mind that more frequent masturbation or ejaculation is going to produce less semen. So that might also be a reason if you are doing frequent ejaculation, but nothing to worry about. Second question. What is the proper way to jerk off? So everyone is going to be a little bit different. Keeping in mind that the most sensitive parts of the penis are going to be the underside of the shaft as well as around the head, but the testicles can also have some good feeling, as well as the feeling between the testicles and the butt. So if you want to touch those areas too and give some extra stimulation, that's fantastic. One other thing to never neglect is lubrication. So using a safe and gentle material or substance on your penis when you are masturbating is going to make things a lot smoother, cut down on chafing. So things around the house that can be used are Vaseline, olive oil, lube. Lotions can sometimes, it depends on the type of lotion, but if it's like a smelly lotion, that can actually have some extra chemicals in it that might irritate the skin. Don't use like a flowery, smelly lotion. But there are lots of things around the house that can help with lubrication. Also in the shower, water is great. So there's not one real perfect way to masturbate, but feel around, feel what is good for you, and don't forget lubrication. Question number 3. I'm a male and I can orgasm during masturbation, but not with sex with a female. What tips might you have? So this is a pretty common predicament in that masturbation, it's easy to pleasure yourself because you know exactly what feels right and you can hit those spots until things happen, and that can happen pretty quickly. When you're with a partner, that can be sometimes a little bit more difficult, and no two vaginas feel the same. So what I would encourage you to do, if you're asking me for tips, try different positions and try foreplay. So making sure you're erect and aroused well before inserting the penis into the vagina. You can kind of get things going and flowing before you insert, and that should also help with ejaculation. Now, make sure your partner's also feeling it too and feeling good. Don't forget about your partner. But again, foreplay and different positions can help you find exactly what feels good for you. Question number 4. I'm a little bit blessed down there, but my girlfriend is really small. Every time we have sex, she ends up bleeding. We've tried lots of things for a while and tried to use lube, and she's even had a few orgasms before we tried, but we can never successfully have sex. What can we do? I think it is wonderful that you are looking out for the comfort and the well-being of your partner. Good job. Yeah, some penises are bigger and it can be difficult for a lot of vaginal anatomies to be able to handle that large penis. So what I would recommend is continue to explore and communicate with one another. It might take a little while for her vaginal opening, or the hymen, to stretch appropriately, but it also might just be that your penis is too big for her vagina or her comfort. And so, other things you can do are oral sex, manual stimulation, or one thing you could do, kind of similar to the last question, is a lot of foreplay with getting things ready up until the moment, and then insertion at the end. And those would be a couple of options for you. So working up the foreplay, really get things going before you insert the penis, but trying other ways you can pleasure each other as well. And give it time. I love that you're using lube. Perfect. Keep doing that. Again, some penises are just going to be a little too big, but it doesn't mean you both can't feel pleasure. Question number 5. I have phimosis, and I've managed to stretch the foreskin a little bit, but my frenulum is still very tight and prevents me from pulling it all the way down when erect. It causes pain. What can I do? So what I think you're talking about is the back of the penis, or the banjo string, where the foreskin attaches to the head. So there's something called frenulum breve, which might be what you have, which is a very tight frenulum, or strand of skin, that attaches the head of the head of the penis to the shaft and the foreskin. Now, this can be painful, usually with erections, and might cause a little bit of the bend in the head of the penis with erection. So, in these cases, and in your case, if it's causing any sort of pain, I would talk to your doctor. There is a topical medication that you might be able to apply to give some relief to that frenulum, or they might be able to talk about a little bit of a procedure to release that frenulum. But definitely worth talking to a doctor. You don't have to have pain like that. And it's a pretty common condition, so don't feel bad about yourself, but definitely talk to a doc. It can get better. And that'll do it for this round of orgasm questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.